Imagine having an eye that looks completely normal, but your brain decided to ignore it. This is not just poor vision. This is a developmental condition that affects your eye if missed early. Today, we are discussing amblyopia, its causes, diagnosis, and treatment approaches. And to guide us through this clinically important topic, we have an expert with us, which is Khurram Nasir.
Thank you, doctor. Of course, yes, amblyopia is one of those conditions in which the early detection makes all the differences. So I'm really glad that we are talking about it right now.
Okay, sir. So let's begin with the foundation. What exactly is amblyopia?
Yes, the amblyopia is a neurodevelopmental disorder in which one or the both eyes fails to develop normal visual acuity during childhood, despite all the obvious optical corrections and in the absence of, any structural abnormality. So in simple words, eye may be physically normal, but the brain will fail to process its, visual inputs properly. So finally, the brain will, suppresses the weaker eye, and then it will lead towards the loss of vision.
So, sir, many people confuse it with refractive errors. So, how is it different from refractive error?
Yes, that's the key point. The refractive errors like myopia, hypermetropia, and astigmatism, they are optical problems, right? The light is not focusing on the retina, right? But once we correct the refractive errors with the lenses, the patient will regain its visual acuity. But in amblyopia, right, even after the correction, the patient won't get the normal visual acuity. Because the amblyopia is a neural processing defect, right? But refractive errors, they are optical problems. So essentially, refractive error is an optical defect, right? But amblyopia is a brain-related neural development issue.
So, sir, what do you think? Why amblyopia develops in the first place?
Yes, the amblyopia develops during the critical period of visual development when the brain is learning to interpret the visual signals. So if the brain receives unequal or poor quality images, right, from the both eyes, so it will start to suppress one eye to avoid confusion and double vision.
Sir, can you classify the types and causes of amblyopia for us?
Yes, doctor. Clinically, we categorize amblyopia on the basis of its, causes. And the first cause of amblyopia is the strabismic amblyopia, right? The strabismic amblyopia in which during early childhood or in childhood, if the patient got squint or deviation in one eye, then brain will fail to process the neural development of that patient, right? So it will suppress that eye and it will lead you towards the amblyopia. This is the first cause. And the second cause is called, the anisometropic amblyopia. Anisometropia is actually the difference between the both eyes, right? My one eye is fine, normal, and the fellow eye, you got the high refractive error, right? So one eye has less refractive error and one eye got the high refractive error. This is called the anisometropia, right? So anisometropic amblyopia is a condition in which one eye got high refractive error, which left untreated, right? So that's why one eye will suppress, the brain will suppress that specific eye, and that will lead that eye towards the amblyopia. This is called the anisometropic amblyopia, right? And the third one is called the ametropic amblyopia. Ametropic means high refractive error is both eyes. So in ametropia, both eyes will get the high refractive errors, right? So this condition can also lead the patient towards the amblyopia, right? And the fourth one is called the meridional amblyopia, in which the meridional is actually coming from the meridians. And meridians, we have meridians in astigmatism, right? So if you prescribe, if being an optometrist, you prescribe the wrong access to the patient or wrong astigmatic correction to the patient, that can lead you towards the meridional amblyopia. And the last one is called the deprivation amblyopia, right? The eye is deprived actually, right? And deprived from what? Deprived from, the clear passage, the clear medium. For example, if you got ptosis, one eye is drooped like this is called the ptosis. And if you got the cataract or you have any, corneal opacity, that can lead you towards the amblyopia, which is called the deprivational amblyopia. So these are the critical types or causes, of the amblyopia.
Very well, sir. Can you please elaborate how can we diagnose amblyopia and what kind of charts we can use to diagnose amblyopia?
No, Dr. Kashmala, simple diagnosis is not important, is not enough. But the early diagnosis is very important in amblyopia, right? If you diagnose amblyopia in 20 years of age or 25 years of age, all in vain, right? So the early diagnosis is the key in treating amblyopia, right? And you talked about the visual acuity charts, but before that, some tests are very important while we are diagnosing the amblyopia. Like we have to record the monocular visual acuity of the patient in amblyopia, right? And there will be, this is very important, there will be a 2-line difference in the both eyes of visual acuity. There will be a 2 lines visual acuity difference, right? And this is the clue you can diagnose, you can relate with the diagnosis of the amblyopia. So there must be a 2-line difference, right, in the visual acuity. So while diagnosing the amblyopia, we go for to record the visual acuity. We perform the clinical refraction, right? We perform different tests to measure the misalignment or deviation of the eyeball with but my real concern while diagnosing amblyopia is the visual acuity charts. Remember, the most important visual acuity charts while diagnosing amblyopia are the crowding charts. Like the logMAR chart is somehow more accurate while diagnosing amblyopia as compared to the Snellen charts, right? And other crowding charts, as you can see in the figure as well. These charts are very important while diagnosing amblyopia because these charts are crowded. The alphabets are covered with the lines, right? So an amblyopic patient will confuse, right, to see that optotypes which are crowded, right? If one patient which is an amblyope and the second patient which is amblyope as well, so if we record visual acuity of one patient, patient number 1 at Snellen chart, and we record visual acuity of the other patient at crowding chart, right? So we can get the better measurement or accuracy while diagnosing the amblyopia in the crowding charts, not in the Snellen chart. So always when you're diagnosing amblyopia, you must use the crowding charts, not the Snellen or conventional charts.
Very well, sir. Can you please tell us the different treatment modes and management of amblyopia?
So we have different mode of treatment and management of amblyopia. Like we have, occlusion and patching therapy. We have optical penalization. We have atropine penalization. We have neural density filters, right? We have dioptic therapy. So we have so many mode of treatments of amblyopia. Depends on the age of the patient and severity of the amblyopia. So first of all is the patching or occlusion. This is the first treatment, first mode of treatment of amblyopia, right? And what we are actually doing in this eye patching or occlusion, actually we have one sound eye or stronger eye and one is amblyopic or lazy eye. So for the specific period of time, we have to patch our stronger eye. Remember the stronger eye. I'm talking about the stronger eye. So we have to put a patch for the specific hours, right, on a sound eye or the stronger eye. So as I said earlier, that the amblyopia is a neural problems. It's a neurodevelopmental issue or problem. So we have to connect our lazy eye to the brain. So we will use our lazy eye or the amblyopic eye maximum, right, to connect with the brain, right, which is already suppressed.
So you talked about the specific hours. How many hours do we need to patch the sound eye or the stronger eye?
Yes, the patching hours depend on the patient age and the severity of the amblyopia. For example, we start patching or occlusion from the 2 hours, right? In the first week of treatment, right, we put patch on the patient's eye for 2 hours, right? And after follow-up of 1 week, we check the visual acuity of the patient. If there is an improvement, then we will continue that 2 hours. But if there is no any improvement in the amblyopic eye or the the lazy eye, then we will increase the hours, right? We will go for the 4 hours patching and then 6 hours patching. So it depends on the improvement in the visual acuity of the patient's eye. And the next mode of treatment is called the penalization. There are 2 types of penalization. One is optical penalization, and the second one is called the atropine penalization. What we are actually doing in the optical penalization, we are actually putting the fogging lens before the sound eye or stronger eye, right? And in atropine penalization, we are actually instilling the atropine 1% daily in the sound eye. So it will cause the blurring effect in the sound eye, and patient will see maximum with the help of the lazy eye or the amblyopic eye. Then that can increase and that can improve the amblyopic eye or the lazy eye. And then the modern mode of treatment in amblyopia is called the dioptic therapy, right? Di mean 2, right? It's dioptic therapy means it in dioptic therapy, we actually stimulating the both eyes. We are actually working on the both eyes, and we are actually stimulating the brain cells to connect with the lazy eye, right? We are actually making a connection of the brain with the lazy eye, right? And what we are actually doing in dioptic therapy, we are actually making our patient to watch some videos in which we are giving different images of different colors to the patient. So in these dioptic therapy or these videos can help our patient to stimulate the the suppressed eye to connect with the brain.
Thank you so much, sir. You explained amblyopia really well. But I think we need to make a detailed video on every treatment option of amblyopia. As you know, amblyopia is a very important topic right now. So we will see you in the next video with the detailed treatment options of amblyopia.